Clinical Ophthalmology with Dr. Imran Ahmed. We will talk about the retinal drying, and it's a very important topic, and all the vitreoretinal and also general ophthalmologists must know how to draw the retinal diagram. First of all, whether the fundoscopy is done with a dilated pupil or undilated pupil. If it is with the undilated pupil, then the examiner will be only seeing the posterior pole of the eye, that is the optic disc, the macular region, perimacular region, and the area surrounding the optic disc. So, if the examination is done with a dilated pupil, then he will be able to see the periphery of the retina. Here you can see that if the pupil is constricted, very limited amount of the light will be going through the eye and only the posterior optic disc and the perimacular region will be visible. Whereas if the pupil is dilated, then a large amount of light will be going and we can see up to the periphery and also peek into the peripheral retina superiorly and inferiorly. So most of the retina will be visible with the dilated pupil. So for proper examination of the retina and fundoscopy, it is very important that the pupil should be dilated. The technique of examination is, first of all, the periphery of the retina is examined, followed by the posterior pole. We always need to trace the vessels if you are unable to see the optic disc or the macula. So if you are tracing the vessel, ultimately you will be reaching the optic disc, and just temporal to the optic disc you will find the macula. Then the disc need to be examined for any pathology. The retinal vessels need to be examined, the macula, and then the vitreous. So this is the sequence of examination with indirect ophthalmoscopy. Then there are various color coded which are used, and while drawing the retinal diagram, the most important one is the red color, and red color is used for the hemorrhages, whether it's pre-retinal, intraretinal, or subhighlight hemorrhages. So any hemorrhage that will be drawn as red. Then attached retina, again, that is drawn as red. The retinal arterial system, the new vessels, open retinal breaks, that is the tears or holes, and the open portion of the giant retinal tear or large dialysis, macular edema again. Then the blue color is actually the most important use is that of the detached retina. The detached retina is colored as blue. The retinal veins is also colored as blue, whereas the artery is red. Outlines of the retinal breaks, that is again blue. The outline of the lattice degenerations, outlines of thin retina and folds, and the detached retina, all these are drawn as blue, and the roll edges of the retinal tears. Then the green color, anything which is in front of the retina, that is colored as green, that is media opacities, vitreous hemorrhage, vitreous membranes, intraocular foreign body, steroid hyalosis. So anything which is in front of the retina, that is colored as green. Then the brown color is specifically used for the choroid, like if there is pigment epithelial pigments beneath the detached retina, if there is pigment epithelial detachments, if there is choroidal lesions or choroidal detachment, choroidal melanoma, all these are colored as brown. Coming to the diagram of the retina, usually this paper is used. It's basically the Amsler-Dubious chart, and there are various, you can see the clock hours are printed over this. There are 3 concentric circles as well, whereas the biodata is also given. The patient name need to be written over here, and the age of the patient also need to be written over here, the gender of the patient, and the date of examination, whether the right or the left eye is examined. And here any information you needed, that has to be written over here, where the break is or any other important thing, and the signature is to be placed over here. The first one is actually represents the equator of the eye, and it's the landmark for this is the entries of the vertex veins. The second one is basically the ora serrata, the second line, and the third line is the junction between the pars plana and pars plicae. According to this, we have to draw any pathology and the fundus were there. The macula is drawn in the center, and the optic disc is on the nasal side of the macula. And again, it depends whether the right eye is examined or the left eye is examined. So for drawing of the retinal diagram, we have to place the chart in front of the chest, and that should be according to if the head end is 12 o'clock, the inferiorly it's the 6 o'clock, and then similarly nasally and temporally. We need to examine the patient from the head end, and the first step is we have to just make chart upside down, so that the 12 and the 12 o'clock will go over here and the 6 o'clock will go over here. And then anything that is visible on fundoscopy, that should be drawn on this chart. We don't need to think about whether it's temporal or nasal, superior or inferior. If something is visible inferiorly over here, it need to be drawn over here, and vice versa. We just need to copy whatever we see on this page. So coming to the examples, in this case, let's suppose it's a U-shaped tear over here while examining the patient on indirect ophthalmoscopy. This is the chart. The first thing is we need to invert the chart, so that the 12 o'clock will come over here, the 6 o'clock will come over here. This is the first step. We have inverted the chart. You can see the 6 o'clock here, 12 o'clock here. Now anything that is visible in this diagram, we have to draw it over here. Like here it's the break, so we need to draw the break over here. It is the optic disc, and this is the detached retina, so the detached retina needs to be drawn like this. And step 2, again you can see the detached retina is drawn superiorly, the attached retina inferiorly. Here is the macula, and that seems to be attached, so the macula is drawn over here. And that is, and the next step, in step 3, actually we just need to again make it in the correct position. Again, bring this 12 o'clock at the 12 o'clock position, 6 o'clock at the 6 o'clock position, and now you are having this the fundus diagram. So your break is inferior temporally with an inferior retinal detachment and macula on retinal detachment. Case 2. In this case, you can see here is a temporal break. Most of the retina is detached, that is the subtotal retinal detachment. Just there seems to be a superior small portion of wedge-shaped area is attached. Again, coming to the same principle, and step 1, we have to make it upside down. The 12 o'clock will go to the 6 o'clock, and the 6 o'clock will go to the 12 o'clock. That is the step 1. Then what we need to do, and the step 2, whatever we are seeing, we have to draw it over here. Like the break is over here, we need to draw the break. We have drawn the break over here at the attached retina, this wedge-shaped area, and the peripheral retina of the detached with some folds in the retina, and the macula is off. And the step 3, what we need to do, just again to bring it in the correct position, and that will be your diagram of the retinal detachment. So anything we just need to copy, and the step 2, everything you see on the fundus diagram, that need to be copied to the page, and that will give you the diagram of the retina. Thank you very much for watching.